Okay, now the screen is seen. Just a minute. Is the screen seen? You can see
Yes,
my screen?
Yes, ma'am.
Okay, good.
Yes, ma'am.
Okay, so with the blessings of the Almighty Lord and with just a minute, and the blessings of the Master, Dr. Hahnemann sir, we begin the session for the day. Two people are there for admitting. I am admitting them, okay? So to mark the death anniversary of our master, we have all gathered here for the Zoom session. The topic being the art of interrogation and case receiving. First of all, I would express my gratitude to respected Dr. Saif sir, Fatima Homeopathic Clinic, Pakistan, for inviting me to conduct the session, and to all the delegates for joining in. So, homeopathic case taking, an art of interrogation. So, what is interrogation? Interrogation, as we discussed in our Telegram group as well, so it is the art of questioning, okay? But the questioning, as it is mentioned in the slide, art of interrogation. So art comes through practice, okay? And practice is not a one-day thing, okay? And art requires practice, so it is a process. Like from a caterpillar to a butterfly, it is a process, okay? So you cannot expect it to be an artist in a day. It requires practice. So similarly, case taking requires practice. Through practice, you will be a very good eminent homeopath, only through practice. We bow our head to the master, the creator of this beautiful science, that is homeopathy, Dr. Christian Frederick Samuel Hahnemann sir. Hahnemann sir, in his book Organon of Medicine, has written from the aphorism number 83 to that of 104 in regards to case receiving. Now we say case receiving. Many say case taking, but it is actually case receiving, because when it is case taking, you literally take it, and in case of receiving, the other person is giving you and you are receiving it. You are the receiver at the other end, okay? So it is case receiving, and rather, to be more precise, we will say it is case witnessing. Witnessing, like say you are witnessing an incident, an accident which has happened, and when anybody asks you, so you just narrate the accident. You yourself are not there in that situation. You are just the witnessing. Like in court also, it is the witness box. Okay, so आपने इस इंसिडेंट, इस सिचुएशन में क्या क्या देखा? You are not the leading one. Okay, so you just witness. So you take the back seat. It's like driver, and the driver is driving. You take the back seat. You just guide the person, the patient, who is sitting in front of you. And supposing if he is going off track, you just guide them accordingly. But you will take the back seat. Let the patient lead. And as the journey unfolds, the case, it will be very beautiful. Okay. So case taking and case receiving is an individual examination of a case of disease. It is the art and skill of interrogating. To interrogate means to question the patient with the objective of unfolding the uniqueness of the disease. Each disease individual has its own uniqueness. That is the base of individualization. Okay. So it is the most important task for a homeopath. Homeopathy is a unique science which helps in treating the individual, his well-being. So let's understand what is well-being. He must enjoy that same ease which he was enjoying previously before falling ill. Okay, so meaning जब मैं बीमार था उसके पहले जो है पहले की जो अवस्था है, आफ्टर गिविंग द रेमेडी the patient has to enjoy that ease. So dis-ease, if you split the word dis plus ease, so dis-ease, not at ease, and we will restore him back to that ease state and total well-being. Mere absence of symptoms is not the ideal cure. The ideal cure, as per aphorism number 2, organon of medicine, the organon aphorism, the rapid, gentle cure. Okay, it has to be gentle. So at mental as well as physical level, as a complete being, it even deals with the feelings and emotions of the patient. I was attending my mentor's clinic, and after this internship, it was first day. So he was like, Dr. Raksha, are you aware? We deal with the mental, we deal with the feeling and emotions of the patient. And that was like a turning point for me. And it was like, oh, it is such a marvelous patty that we are dealing with the feelings and emotions of the patient. So no other petty in near future would also deal with such a subtle level of feelings and emotions of the patient. It is usually seen that a patient comes to the doctor because he is concerned about his symptoms. Only when it is bothering, the patient comes to the doctor. And as is reflected in the patient at the psychosomatic level, the mind, the psyche is affected and it is reflected on the soma. Soma is the body, and it leaves an impact on the patient's behavior at various levels. See, we are every time interacting with the environment. It is family, friend, workplace. The homeopath go to the core to get the gist of it, thus individualizing each and every patient. Each individual is unique. Many a time it so happens that all the parameters of the patient are within the normal level, meaning सब reports तो normal है, लेकिन the patient is still feeling sick. So wherein the conventional mode of treatment, this conventional system of medicine would not be able to help much to these patients. It is here that homeopathy helps due to its beauty, which lies in the art of case taking. So this is the main crux, and this is very, 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 very important. And to master this art, practice is of utmost importance. Even disease, that is this plus ease. Herein, it is clearly understood that patient is not at ease. Okay. So there is no such format in homeopathic case taking. So supposing if the patient is entering the clinic, नाम बताइए, काम बताइए, एज बताइए. The patient is starting with, मुझे बहुत सर दर्द हो रहा है डॉक्टर, what do I do? And you please help me out. No. According to the format, it is नाम बताइए, age बताइए. No. Let the patient talk. Let the patient talk. If he is saying about his headache, Let him continue because he is bothered about it. So that is the reason why he is telling you about that. Let him continue. Name, age, you can ask later on as well. Okay. So you may start from where the patient begins. Do not interrupt with the flow. It's only when homeopath feels that the patient is going off track, like I said, no, for the driver, the driving seat, then does a homeopath intervenes. Homeopath ought to be a patient listener, a keen observer with alertness. The gestures, the facial expressions, the verbal and the non-verbal communication. The tone of the patients are taken into consideration, the way of dressing, the way the patient behaves, right from the time the patient has a telephonic conversation for his appointment for the time has entered the clinic. जब से appointment लेते हैं ना आपका case checking start हो जाता है, case receiving. Okay, so and you have to be a keen listener. Mohammed Saifullah, you have raised hand. I will answer your query after the session, at the end of the session. Okay, hope I am audible. Okay, so I will answer at the end of the session your questions. Okay. Audible, I am audible, na? Unmute.
Please continue.
Okay, okay. A fastidious person. So fastidious is hard to please a personality. Okay? So now we are coming with this. Say a person is coming to your clinic and he is fastidious, a hard to please a personality. Okay. So what would be the behavior of such kind of a patient? He will arrange all the documents in the file, neat, clean, order, date-wise with proper filing. Okay. An anxious person will get a piece of paper with the symptoms the patient suffering from on it and read out. On asking, why did you get the piece of paper along with you? Then he will say, the reason behind the same is, what if I forget? So I get a piece of paper that shows his anxiety. He's anxious about the health and he wants to narrate each and every symptoms to the physician, and he gets it the piece of paper so that he doesn't forget it. Okay, any symptoms जो है वो रह न जाए, इसके लिए piece of paper के साथ आते हैं and with all the symptoms written in it. Then some patients are reserved, introvert personality, will ask only a few questions, is put forth to them and to the point, as they are well marked by a good homeopath. So say patients such as natremure, ignatia with a secretive reserved tendency, they will not open up in the first session. So in the subsequent session, they will open up. So the physician needs to keep a lot of patience. And if you try probing such patients in the first session, then the problem is maybe next time the patient won't turn up because you have hurted their emotions. You had no intention of it, but the patient will take it in that way. Okay. So a difficult task to attain, but through practice, it is possible. Homeopaths need to be an unprejudiced observer, free from bias. It is difficult, but impossible says I am possible. So if we try, we can be an unprejudiced observer. Now, how to be an unprejudiced observer is, like in childhood, we had slate and pencil, chalk, rakhte the. So that was a clean slate. So you have to be unprejudiced, free from bias. So ये patient है ना, ये ऐसा ही रहेगा, and I will prescribe this remedy to this patient. No, we are not going to do that. And this patient, we will be taking the entire journey, the case, and we will analyze, we will evaluate, keeping in mind that each individual patient is unique and the behavior which he or she is behaving in a particular fashion, that is because he is diseased, he is not at ease, and that is the reason why he is behaving in such a particular fashion, and we need to help him out. The physician may even take the help of relatives, attendants, relatives to help him arrive with the points wherein he needs to probe further with regards to patient's behavior, as this may help the homeopath to arrive at the right remedy. Okay. As is seen, different patients react differently to a given stimuli. Their adaptations to differ. Like say we take an example of a polar bear. A polar bear has fur, and the coniferous trees are cone shaped. So the snow falls. So that is their adaptation. On the extreme side, the north, there are polar bears and they can survive because of the fur which the Almighty Lord has given them. The polar bear, the coniferous trees where the snow slides down. Okay. So homeopathic medicine helps patient adapt to the situation. It builds the immunity of the patient as well as help cope up accordingly. So acute case taking. In acute case taking, we consider the symptoms that are present per se, and a homeopath look out for an exciting cause. The exciting cause is very, very, very important in acute case taking. Okay. And the altered state of the mind. That is aphorism number 211. Dr. Prachi has also mentioned about it, the disposition. Chronic case taking. In chronic case taking, the totality of the symptoms are taken into consideration, the overall physical complaints along with the mental state of the patient, herein the appetite, sleep pattern, desire, aversion, thirst, stool and urine as well. Family history, the fundamental cause is thus important in chronic case taking. In case of females, the menstrual history too is considered. The rapport building. Okay, so it's like the rapport building is your patient and the physician relationship. That is the IPR. Okay, so the IPR is interpersonal relationship, and it's between the patient and the physician. You need to build that rapport, that so that the patient trust in you, confide in you, and can vent out their sufferings. Okay, the homeopathic physician only mission is in the overall well-being of the patient and not symptomatic relief. The mere absence of symptoms is not cure. Okay, and it's through a proper case taking, this mission to provide the patient with a healthy and positive outlook towards a given situation is achieved. Okay, with education is not just understanding the fact, but training the mind to think. With this, I sum up my session, and thank you so much everyone for being a patient listener. Thank you, Dr. Saif. It was a wonderful initiative on your side, and especially when we mark the death anniversary of our master, who has given us this dynamic science, the greatest gift to humanity. Thank you so much, everyone. All the delegates.
Thank you.
My
Thank
pleasure,
you.
my pleasure. And kindly let me know the feedback. How was the session, so that in near future also I can rectify, improvise on myself. And your session, the feedback means a lot to us. So I'm stopping the screen sharing, and you can start with your queries and doubts if any. I will revert back. Okay. Okay, 1 minute to chat.
Thanks, ma'am. Very fruitful session here. Nice to hear you.
Thank you so much.
Thanks a lot.
And I hope I have almost tried my level best to cover all the points. In case any queries there, kindly please address the same. I will please ask and I will address the same.
Okay. Ma'am, you describe three persons: fastidious, anxious, and reserved. So please differentiate between fastidious and proper to.
Differentiate between.
Anxious and
Okay. Okay.
yes, ma'am. Anxious and it's near to forgetful or express cannot. So what is the basic
Sir,
difference
your
between?
voice is breaking. As far as what I could comprehend, you want to know the difference between fastidious and anxious, right?
Yeah, ma'am. No, sorry, ma'am. No. Fastidious and proper to.
Okay. So fastidious is hard to please. So whatever you do, it is very hard to please this personality. Meaning that कुछ भी करेंगे इनको पसंद ही नहीं आता है. मैंने कितना कुछ किया इनके लिए, लेकिन he is really hard to please the personality. We cannot please this personality. Say for arsenic patient, no maid will come to arsenic place because they are such a hard to please personality. पहले डेटॉल से मॉप करो, फिर प्लेन वाटर से भी मॉप करो, फिर जो है सोप वाटर से भी मॉप करो, फिर वो वापस से ड्राई मॉप भी करना है. So then that maid will say, माफ करो, मैं नहीं आ रही हूँ. Next day the maid will not turn up because the maid feel that ये जो मालिक है, मालकिन है, वो तो कितना बोलते हैं, ये माफ करो, वो माफ करो, मुझसे नहीं होगा. She is very hard to personality, and even if after doing also she is not satisfied. So this is fastidiousness. Okay. Hope it's clear.
Ma'am, my question was that you describe patient who is fastidious. Fastidious who come with the proper lab reports, proper file, and proper mentions you this case. That is the fastidious.
Let's see.
But
It is hard to please. Hard to please. So he will maintain all these file and all, and he want you to see each and every report and all. And until and unless he is not satisfied from his side, that yes, the patient, the doctor in turn has seen, he will keep on saying that you need to see it, you need to see it. So yes, I have seen your reports, but he is not satisfied. नहीं, आपने देखा ना, आपने बराबर से देखा ना कि नहीं देखा.
Okay.
और जो है आपका ना, देखो मैंने फाइल है ना, वो डेट वाइज लगा है. आप फिर से वो फाइल जब भी रिपोर्ट निकालेंगे ना, तो डेट वाइज ही लगाना. हाँ. And you will feel like, okay, fine, I am doing. But they are so hard to please a personality. So whatever you do, they are not at all satisfied. Okay.
Thank you very much. Very good explanation of fastidious.
Thanks a lot, ma'am. Thanks.
Thank you.
Ma'am, it's a request for you.
Yes.
In
And see,
future,
if you want.
Yes. I want to add some request for you.
Okay.
Our participants are mostly comfortable with Hindi also.
Okay.
So please make a blend of English and Hindi. It would be very easy to understand the core of the meaning and presentation.
Okay.
Thank you very much.
Okay.
So nice.
Yeah, thanks. And so if you want to know about an anxious person, anxiety.
Yes, ma'am.
Okay, so anxiety is हमेशा चिंता करते रहते हैं. डॉक्टर, एंजाइटी हेल्थ अबाउट, डॉक्टर कुछ प्रॉब्लम तो नहीं है ना मेरे हेल्थ के रिलेटेड, एवरीथिंग इज फाइन नो. See, I give you an example, like an aconite patient, and I was in my mentor's clinic. So sir asked me to take his BP. Okay, so it was on the higher side, high level पे BP था. तो हमने सर को बताया कि सर BP जरा रेज है. So sir was like, madam, no, he is aconite patient. So and then later sir told me that aconite patient, if you say the BP is high, he will panic. वो जो है घबरा जाएंगे. Okay, वो घबरा जाएंगे. The okay 10 minutes are there. So जो है, so aconite patient, then sir told him that you don't worry, and reassured him that nothing to worry, and you are all right. It's the BP just showing on the higher side, but nothing to worry. You are all right. And then that aconite patient was reassured. उनको सांत्वना मिल गया फिर कि जो है बीपी हायर साइड पे है, बट कोई चिंता करने की जरूरत नहीं है आपको. वी विल मैनेज विद द मेडिसिन एंड ऑल. तो देन उसके बाद में उनको जरा अच्छा लगा. So this is the case with the aconite patient. Okay. So I hope I have answered the question. Dr. Adil.
Dr. Naveedava.
Okay.
Dr. Adil.
हाँ, yes. So and session related भी कोई भी question रहेगा, so you can.
Ma'am.
हाँ. So we still have
one more thing, ma'am.
We still have 8 minutes. So
yes, ma'am. One more thing, please.
Yeah.
You mentioned here in acute cases exciting state. So what is meant by exciting state? Please describe.
Yeah.
Thanks.
So it is like the exciting cause. Supposing बारिश में भीगने के बाद किसी पेशेंट को सर्दी जुकाम हो गया, so getting wet in the rain is the exciting cause. Okay. And this is very important when it comes to acute case receiving, because in chronic many times it so happens that the patient does not elicit the exciting cause. Okay. But in case of acute, it is like उनके दिमाग में already fresh रहता है वो, and he is able to tell you about the exciting cause. Okay. So then it becomes prime importance, and exciting cause has to be taken into consideration. And one more thing I want to add in, that the maintaining cause is like the flowers are kept in the room. That is even mentioned in the organon, that flowers are kept in the room, and the patient is allergic to the flowers. So how much ever medicine you will give, patient will not be cured unless and until जब तक वो फूल जिसके वजह से पेशेंट को एलर्जी हो रही है वो ही रूम से नहीं हटाया जाएगा, तो पेशेंट ठीक नहीं होने वाले कितने भी मेडिसिन देंगे, बिकॉज दैट इज द मेंटेनिंग कॉज. एंड सेकेंड पॉइंट इज द मार्शी एरियाज. जो है सब जो है मार्शी एरियाज में मलेरिया के पेशेंट है और मस्कीटो ब्रीडिंग एरिया है जहाँ पर मस्कीटोज रहते हैं, तो उस पेशेंट को वहां से जो है ठीक होना मुश्किल है, बिकॉज he is residing in that area where the mosquitoes are breeding. उस एरिया में जहाँ बहुत सारे मस्कीटोज है, you cannot expect the cause because this is the maintaining cause. Maintaining cause की वजह से जो है पेशेंट आपके ठीक नहीं हो पाएंगे. Okay?
बहुत शुक्रिया.
Okay. So
Thank you very much.
Yeah.
Thanks, ma'am. Ma'am, one more, please.
Dr. Naveed, I think. So we have
yes,
6 minutes.
Yes, one more, please, ma'am.
I will try to answer your query. If not, I will answer in the Telegram group, because we have just 6 minutes. Okay.
Ma'am, you mentioned for reserve. Who is reserve? That only answer you what you asked to him. So what is the difference between reserve and laconic?
What is the difference between
reserve and laconic?
Okay, reserved person.
Laconic also reply in a short way, and reserve also. So what is the difference between
reserved person is the one who will not open up. Okay. So this person will be like we will not allow anybody to enter his zone. His zone, he is not supposed to. You are not supposed to enter that zone. This is that zone, and there is a line of demarcation. There is a boundary. So if you try to enter in, he will not permit that. That is the reserved. And even if you try to ask questions, he will not open up. That is the reserved personality. Okay. So this reserved person, how much ever you try, but वो जो है ना क्या होता है कि फर्स्ट सिटिंग में वो नहीं ही ओपन अप होंगे, and patients like Natrum ignatia, they won't open up. But then in subsequent splittings, they will open up. Okay. So you need to have a lot of patience with such patients. And if you try to probe in, he won't turn up. वो वापस नहीं आएंगे because उनके लाइफ का जो जोन है, पर्सनल जोन, आपको परमिशन नहीं है एंटर करने का. See, Natrum का एक ऐसा है कि leave me alone. He says that. Leave me alone. मुझे अकेला छोड़ दो. क्यों? Because sympathy or consolation aggravates a Natrum patient. मुझे नहीं चाहिए आपका सिंपैथी और कंसोलेशन, मुझे नहीं चाहिए. जो है आप सहानुभूति दिखाएंगे, आप कहेंगे कोई बात नहीं, ठीक है, सब ठीक हो जाएगा, ठीक हो जाएगा. आई डोंट वांट टू लिसन, आई विल मैनेज, लीव मी अलोन, मुझे मत पूछो. एंड वन मोर थिंग, आर्निका सेंसिटिव टू टच है. तो मेंटल टच, एक तो फिजिकल टच के बारे में हमें पता है, लेकिन मेंटल टच कब लेंगे? इन केस ऑफ रेप केसेस, जब हादसा ऐसा हुआ है कि उनको ऐसा है कि उस हादसे के बारे में मुझे मत पूछना डॉक्टर, क्योंकि आपके पूछने से मुझे हर्ट होता है. that is the mental touch and they won't permit you. So if you got to see, Natrum का अपना अलग पर्सनल जोन है. when it comes to arnica, the reason is different. So अलग अलग जो रेमेडीज है उस हिसाब से इंडिविजुअलाइजेशन, why Natrum को नहीं चलेगा, why arnica को नहीं चलेगा, you need to learn it in that manner, so that will be easier. Okay, and we have just 2 minutes. I think I'll wind up, and rest of the questions we'll take up on Telegram group. Okay.
Okay, ma'am.
I will revert back. Gratitude
Thank you very
to
much.
Dr. Seth sir,
Thank you.
Dr.
Thank you very much.
Naveed sir, Dr. Adil sir, and
Adil.
all the delegates present here. And if I have not taken anybody's name, kindly excuse me. But I am really sincerely grateful to every one of you and your patience listening.
Very good explanation. Thank you very much for your knowledge sharing.
And today's day, we mark the death anniversary. I feel truly it was a fruitful day when we could reach to the borders, and through technology, it has become all the more easier.
Yes,
Sure,
yes.
ma'am, sure.
And so we'll take up the next questions on Telegram group. Okay. Thank you so much.
Okay.
Thank you, ma'am.
Okay.
Thank you, ma'am.
Thank you, ma'am. Thank you, Dr.
Very good, ma'am. Very good.
Thank you all.
Thank you, ma'am.
Allah Hafiz.
Allah Hafiz.
Allah
Allah
Hafiz.
Hafiz.